Good afternoon. Dr. Deuk Majin, streaming live spine surgery from Deuk Spine Institute. Our patient comes from the nearby area. She has suffered with debilitating lower back pain for many years, over 20 years as a matter of fact. She found out about Deuk Spine Institute. We did our free MRI review online, and she actually came in and saw me as well because she's close. We determined her pain to be coming from disc, facet, SI, piriformis. She chose to come in and have it all fixed, so here we are. We're going to get it all done in one stream. Thanks for joining us. If you have questions, feel free to type up your question, and I'll answer it for you. Are we ready, doctor?
Yes.
Our patient is asleep, laying on her belly. This is her back here. We're going to start at L4-5. Put a little numbing medicine first. And then we're going to go in with a spinal needle. Get into the disc through the foramen. You can see that on the x-ray shot. And we are just about there. Shot. Now we are there. AP. That's good. If you have questions, type them up. Perfect. We are there. You can see she has a catheter there in her spine. All right. Now she's got a listhesis as well at 4-5. Very common problem. We see that a lot. Does not need to be fixed. We're just going to go repair the disc. Shot. Shot. I think we're in. We're going to verify with the discogram.
You doing okay? You okay?
Shot.
Open your eyes.
Looks good. I'm happy with that. We're going to go ahead and get started. I don't need her awake for that discogram. Henry, this patient has 1, 2, 3 facets. So a disc, 2 facets, that's 3. SI joint 4, SI joint 5, piriformis 6. 6 distinct causes to her back pain, and we're going to fix all 6 right now. Can you show the audience the 30 different things that cause back pain while I place our retractor in so we can get started with the laser surgery?
Of course.
I'm Dr. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. Welcome back. So our patient is having a little bit of sensitivity to the procedure, and we've decided to change gears a little bit, and instead we're moving to our facet joints. We're doing our facet joint denervation. She's a little bit lighter, which may be okay if that's what you want. I don't mind, Dr. Berndes. It's whatever you think is best. Make sense?
Yes.
So you can keep her wherever you feel is comfortable. Shot, I can operate. So we're on the facet joints, right side. We just finished L4, L5, and I'm about to get the L5 dorsal ramus shot. It's at the bottom, right where the tip of that is. We okay, Berndes? I could feel the pain nerve right there. Literally. Just destroyed it. Shot? No, I'm actually working my way down to the SI joint. You like that, Jordan? Huh? Might as well. Shot? So it's a bit of an unusual case because normally we would do the disc first, but she was so sensitive to the procedure, we decided to go down to the SI joint first. Shot? I mean the facets in the SI joint. All right. That's. Huh? Yeah, I know. We've already done the facet, and now I'm literally on the SI joint. Shot. So I'm making my way down the SI joint, denervating those nerves. I'll need a new. Okay, so we're done with facets, and the SI joint on the right. We're going to do the SI joint on the left and the piriformis. And then we're going to come back to the disc because that's the safest thing for the patient to do. Let's do the piriformis real quick. Shot. Then we'll go get the other SI joint. Any questions?
Yes, we just got a question from Lanu on YouTube
Shot.
asking how severe is her back pain?
Her back pain is severe.
8 out of 10, 9 out of 10.
Yeah, 8 to 9 out of 10 all day, every day. She's incapacitated, basically wheelchair bound. Taking tons of narcotics, morphine every day. Just her life is just wasting away, inactive. And she has a wonderful husband who's been very supportive. Shot. And we can fix it. The issue, though, for us right now is her heart. It's stable. Her heart has been very stable the last few minutes, but earlier it wasn't so stable. As soon as we were getting into the disc, because we know that's a painful disc, she was getting a reaction. So right now we're treating her piriformis. Shot. All right. Hold on. Let's get back to where we need to be. Shot. Okay, that looks good. Shot. Her muscle is just tightening up, but that's okay. I'm fine with it. Shot. It's a very painful muscle for her. Shot. I'm just trying to figure out where my borders are. Any questions?
No current questions, so we do have a comment from Lanu once more on YouTube saying, I hope her heartbeat isn't
Shot.
over 130.
No. Her heart rate, the problem is not her heart rate going up. She has a vasovagal reaction. So we're just giving it time. We're watching it before we stimulate her too much. So it's dropping down. It went down into the 30s when I started putting because her disc is so painful that as soon as I touched it with the dilator, her heart rate dropped down to the 30. It went from 60 to 30. So we stopped right away. And now we're just watching it. But while I'm watching her heart rate, I'm doing the other pain areas. Her piriformis, her SI. God, a lot of scar tissue here. Shot. She doing all right? Yeah. All right, we're just about done with the piriformis. Let's hope that does it for her. All right, so we got the left SI left to do and the disc. Any questions? I'll do the SI first.
At this moment, no current questions.
We're going to do her left SI joint. Show the audience why we treat the SI joint, why it's painful, and why we treat it.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, we're done with the left SI joint. Now we're going to move on to the disc. If we can do it, we're going to give it our best shot. Go ahead, Jordan. Well, let's see if this works. So while we waited for her to stabilize hemodynamically, we got the 2 SI joints and the piriformis done. So, here we go. You ready? She does not like that. Take that, hold on. Hold on. All right.
You see the heart rate? I got the heart rate fixed. Now I just gotta work on the sedation.
Well, we're almost done. I would love to get this because it's such a painful disc for her. We need about 10 more minutes if you're okay. I don't mind the sedation. Her sedation level for me is fine as long as it's okay for you. And she's not happy with that. All right, let's get the tube, the dilator out. Let's show the audience the 30 causes of back pain if we haven't done that already.
Oh,
I think we did.
Yes, we have.
And let's show them how the Deuk laser disc repair works.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
I got the A-OK sign from Dr. Berndes. The heart rate is back to normal. All right, there's your inflammation, folks, right there, the red stuff. We're going to go in and grab that stuff out of there. That's what's causing her back pain. This disc was extremely painful. It literally made her heart start jumping around, slowing down. We call it a vasovagal. And Dr. Berndes was able to stabilize her so we can fix this painful disc. But this thing is probably causing so much pain for her. Here you go. We're going to get the laser in and start cleaning it up. Any questions from the audience?
Yes, we have a question from Lanu once more on YouTube asking, looking at the images, I could see it's very severe.
Yeah.
Did she ever seek any treatments?
I don't know what treatment she's had. I think she's tried conservative treatment, epidural injections, physical therapy, medications, anti-inflammatory.
Tried it all.
She's tried it all, Dr. Berndes says. He knows her history a little better. None of it works. That's the problem. That's why we do the surgery. Because conservative treatment does not cure back pain, ever, ever, ever. That's something that a lot of people don't understand. They all think that if I just wait, if I give it time, if I do acupuncture, if I do physical therapy or chiropractic, my back pain is going to go away. It goes away for a few weeks, a few months. If you're lucky, it's coming back. It's just a matter of when. Whenever you injure a disc, there's only one way to fix the pain from the disc permanently, and that's this surgery you're watching right now. Deuk laser disc repair. People don't want to hear the truth. It's not my job to tell people what they want to hear. I don't want to tell people what they want to hear. I want to tell people the truth. In my 30 years of treating back pain, what I've discovered is that when the number one reason for back pain is the disc, like this patient right here. It's a painful disc. The painful disc just does not heal on its own. It's not possible for it to heal on its own. The pain will get better on its own for a short period of time. But as soon as you start getting up and being active again, the pain comes back. That's universally true for all patients with back pain. Okay? As soon as they get active, start doing things like sports or walking or exercising, then the pain ends up coming back. That's because what happens is you're re-herniating new pieces of herniation into the tear. It's creating another cycle of inflammation. It's the inflammation that's causing the back pain. Inflammation within the tear in the back wall of the disc. That was discovered here by me at Deuk Spine Institute 20 years ago. 20 years ago, I did my first endoscopic procedure. My patient was getting the surgery done for leg pain, and he had a pinched nerve, sciatica, and when he woke up, his back pain was completely gone. And I was just as surprised. I mean, I was surprised. I guess the patient wasn't surprised, but I didn't expect the back pain to go away. And it was a reproducible result. In other words, every single patient I did the laser surgery on, their back pain went away. And I soon realized what was happening was it wasn't about unpinching the nerve, because lots of doctors will unpinch the nerve with their microdiscectomy. That doesn't cure back pain. Microdiscectomy never cures back pain. What was happening was I was cleaning the tear, doing an annular debridement like I am right now, removing this stuff right here. And this is where the pain is coming from, this scar tissue and inflammatory tissue, little nerve fibers that are pain nerves, and calcium called dystrophic calcification, and just getting rid of this herniation right here, stuck here. That is the key, and it's called an annular debridement. That is the reason I can cure back pain. And I was the first person in the world to publish that, the first person to do the surgery, and so we called it the Deuk laser disc repair, because it was a unique procedure nobody else has ever done or described. There's a piece of herniation. Look at that one right there. So look at this here. This is what's stuck inside the tear. Can you see this, Henry? That right there. That is a piece of herniation stuck inside the tear, causing inflammation and pain. That's what you have to remove in order to cure the patient's pain. But not just the herniation. You got to get rid of all the inflammatory tissue as well. That's what the laser does. There's no other tool in medicine that gets rid of this tissue. See that pink stuff? That's where the pain is coming from. That pink stuff is inflammatory tissue or inflammation. Same thing. Inflammation is a process. Inflammatory tissue is the result of the inflammation. Basically, study your inflammatory system. It's made up of little cells and chemical signals, and basically cytokines, which are little chemical messengers released by cells, causing other cells to do things, and nerve growth factors, epithelial growth factor, endothelial growth factor, all of those cytokines or chemical messengers that are producing physiological changes within the tissues around the back of the disc. That's what precipitates the inflammation and the pain. Okay, it's all due to the herniation. Any questions? We're almost done. I need 3 minutes, Dr. Berndes, 3 minutes.
At this moment, no current questions.
All right, so once again, we normally start by fixing a disc. We couldn't do that today because of her medical conditions. And as a result of that, we decided to get started on the things that didn't hurt as much, because the disc is so painful for her that when we started to go inside the disc to fix it, we went inside the tear, actually, not even the disc. The tear was so painful that her heart rate started to fluctuate in a way that could potentially lead to problems. So we stopped immediately as soon as we saw that, and we moved on to fixing things that don't affect the heart rate so much. So that's why we did everything else but the disc first. Sometimes you have to adapt, right? Even surgeons have to adapt, and anesthesiologists have to adapt, right? So circumstances change sometimes, even in the operating room, and you get surprised. And you can't let those surprises affect your ability to care for the patient. So you have to stay nimble. Just about finished. Here's the end of the herniation. You guys see it right there? This stuff was actually pinching her nerve too, so it was giving her some leg symptoms. I'm a little concerned about the piriformis. I think I got it completely done, but I wasn't entirely happy with it. So we're going to see how she does. Usually when I worry like that and I still feel like I got it, patients do fine. But occasionally I have to bring somebody back and redo it because I didn't get all the torn fibers and scar tissue out. You don't know until after surgery, until the patient tells you how they're doing. That's the only problem with this, is that you got to wait for the patient to recover before you know how successful your treatment will be. But having done so many of these, we've not had any failures. We've just had a few that we had to take back and do a little bit more, but in the end their symptoms were gone. Hopefully she won't need that. I'm sure Dr. Berndes doesn't want to have to take her back and put her again down. All right, we got 1 minute left. You guys can see the epidural fat right outside the disc. This is the last of the herniation right here. I feel really good about it. I know for sure this was a symptomatically painful disc without even doing a evocative discogram. We did a chromodiscogram only, but man, did she have a response to this disc, right? Very powerful indication of how this disc was affecting her life. Poor thing.
Pain normally increases heart rate, but there are times when it reduces it too.
Yeah, Dr. Berndes makes a good point. When a patient's having pain, a lot of times the heart rate goes up. Like Lanu was saying, on the stream. But there's a few cases where the heart rate will go down. And that's what we experienced. So we had to stop and regroup, and here we are, we're done. We did it. We did what we needed, what we came here to do. I'm very happy about that. I think she's gonna do fine. Thank you, Dr. Berndes. Thanks, everybody. Great work. Any questions or comments?
No current questions.
Our next patient has a 1-level L4-5 Deuk laser disc repair. He comes from Georgia.
You need a discogram on him?
I'd love to, but we don't need one, no. No, we don't need one. No. Yeah, the next patient comes from Georgia. Sad thing is he has 6 discs that need to be fixed. 6 sides. We can only do 1. He's not able to do more than 1 financially, so we're going to do just 1. But he's a good man. I told him we're going to do everything we can to help him.
He got injured in the military.
He got injured in the military. sad. And I wish we had somebody who would step up and help him cover the costs of his medical care, because the VA won't do it. Our veterans system just sucks. Our politicians suck. They let our injured military suffer. They won't fund the VA adequately. They're basically a bottleneck for healthcare in America. They promise these people when they come and join the military, if they get hurt, they have medical needs, they'll be taken care of by our medical system, but then that's not true. They lie to them. Our VA hospital just delays their care and hopes the veterans just off themselves or die of some other cause so that they don't cost the system money to fix them. It's disgusting, but that's the God's honest truth. I've worked in the VA hospital 7 years in one of the busiest second busiest VA system in Florida. And I'm tired of people not knowing the truth about the VA system. All the lies, all the covering up the politicians do. They steal the money out of our country, and they don't pay for the people who need it and deserve it. All right, thanks for joining us. We'll be back shortly with a veteran of war to fix one of his discs. I'm here with one of my post-op patients. We get a lot of requests for Dr. Deuk. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Deuk laser disc repair done at L34, L45. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Deuk Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Deuk Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3, 4, 4, 5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient. There was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us, and you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.